Special thanks to the Tourism Authority of Thailand.
Welcome again to Health Focus at Bumrungrad. Now, one of the things that surprises me is the number of people that have problems with their backs. The lady sitting next to me at the moment has lived in Thailand for some 13 years. She looks pretty fit to me. She's an actress. She works very hard too, and she loves sport. So how would she end up with a disc problem? We thought we'd take the pleasure of introducing Anne-Sophie Jumell to find out what actually happened. Thank you for joining us. You're very active.
Yes.
So, Anne-Sophie, how did you end up with a back problem?
Because I do a lot of sport. I perform theater play. So the last play I did in October 2008, I couldn't even stand up because my back hurt me so much, and so I performed it, but it was so hard. And after that, I stopped working because I work at Alliance Française. I stopped working for 1 month. I had to lie on my bed all day, and I tried the chiropractic. I tried different way of because I think first that this can be
just something that you moved and was just a bit awkward.
Right. After around more than 3 weeks, my chiropractor he told me that I should do MRI to see what happened in my back. So I did MRI, and even me, I don't know anything for surgery, but I can see that there was a very big problem. So
painful, very painful.
Very, very painful, yeah.
But tell me, did it just happen? Or, I mean, you were saying you were acting. Were you standing and suddenly the pain was there?
No,
or?
it's go day by day. I can feel something tense in my back, and then I couldn't stand up, and it's happened
little by little.
Little by little,
and then finally you have to lay on your back.
Yes. And this was in December 2008. So, I'm patient in Bumrungrad for 13 years because I live in Bangkok for 13 years, and Bumrungrad is my hospital. So I decided to come here and to speak with a French doctor, to speak in French.
Yes.
Yeah. So I saw the French doctor, and when he saw the MRI, he said, "Okay, I think you need to go to the orthopedic center now and go to see orthopedic." So that's why I went to the orthopedic center and I saw the doctor Nanthadej.
How important is it as a French person? You've lived in Thailand for 13 years, but you actually wanted to see a French doctor. I mean, that's quite unusual, isn't it, in Thailand to catch up with a French doctor?
Yeah, but it's because we need to have some explanation, and in French it's easier. So
in your native language.
Yes, in my Latin, and I didn't know really what happened. I just see that there was a big problem that I couldn't even move, and I work, I do sport, I do theater. For me, it was awful.
It was like the end of life in a way.
Yes, right. I was desperate, and so I had the explanation in French, and it was herniated disc. Yeah. So the doctor decided me to make surgery quite quickly, in fact.
And I believe you had a fantastic Christmas present in year 2008.
Yes, the surgery was the 25th December.
It didn't worry you, just had to get it done.
Yeah,
yes.
But it was like a Christmas gift, really, because it's my life. I could, after the surgery, I stayed 4 days or 5 days at hospital, but then after that, I had to be careful for a few weeks, and then after, I can perform again. I can
have a normal life.
Normal life. So it was a Christmas gift.
Right. Now, of course, we talked about Dr. Nanthadej when we were talking to Anne-Sophie about her problem of herniated disc. Always we like to be able to talk to the doctor himself, because I think most of us, we know we have discs in the back, but we don't know what the problems are we can have. Dr. Nanthadej, as a leading orthopedic surgeon and specialising in the spine, can you explain very simply what is a herniated disc?
Okay.
First of all, the disc itself. The disc is like a cushion that stay between each vertebra. It's supposed to act as a shock-absorbing material, and inside there's a gel-like substance. With time, there's a chance to get degenerated and get narrower. And the wall getting weaker, the gel-like substance that I just mentioned can come out and leak out. And when it's come out, it can irritate the nerve roots, or it can compress the nerve roots as well.
Why does it get weaker? Is it because, perhaps in this lady's case, that she actually is very active, and so therefore maybe too much exercise, too much boxing, whatever she was doing, actually created the problem for her?
I would say that's one of main reasons why she has this problem, because she's a very active lady. But part of it because her lesion is at a level L5 and S1, which is the lowest part, and that's the part that carries the whole weight of your body. So that is it make it easier to be the target for this problem.
She came to you some 4 weeks after first having the problem, and it always surprises me that people can go that long before they actually come. I mean, she did try alternate treatments, I have to say, but if people have this problem or have a back problem and then you can't move, surely you've got to go to the doctor straight away.
Yeah, you should, because nobody should have to wait that long. But in her case, again, it also depends on the degree of the herniation, because when it just comes out just a little bit, the pain that you have coming from the chemical reaction, which in this case is irritation. At this stage, medication or just rest might help you get better. But if you wait long enough, or the problem is more severe than that, and the more this coming out more, and that will change from a chemical reaction to be mechanical problems. I'm talking about the nerve getting compressed by the disc.
And that's what causes the pain?
That's correct. Both of them can cause the pain. Chemical reaction or mechanical problem. The chemical reaction, you get the medication. But mechanical problem, you need the surgery.
Now, you chose to do surgery in her case, and obviously it was severe when you did that. She said that you gave her the best Christmas present ever. You operated on Christmas Day, and from there on she could see the light and she had no more pain. What does the surgery consist of?
The surgery is a microdiscectomy. In the past, we used conventional discectomy, which involved with a long incision. Now we have the option endoscopic surgery or microscopic surgery. In her case, we use the microscopic surgery, which it makes the incision to be as small as like a 1 finger breadth, and the patient only stay in the hospital for a day or two.
That really surprised me. I mean, somebody suffers for a month, come into the hospital, has the operation, 3 or 4 days later they're out of here. Is it as easy as that? Is it really?
Well, it's a long process. Incision itself is very small. The procedure is not that long, but of course the surgeon himself has to get a lot of trainings in order to reach this point.
And then, of course, obviously the patient has to come back for regular checks up to make sure that the actual back is still as it should be following the operation.
Especially in her case, because she's very, like I say, she's very active. She loves Thai boxing, involved a lot of rotation, moving. So I have to make sure that her back muscle is still strong.
Thank you very much.
You're welcome.